Today, I'd like to talk a bit about the nuanced differences in providing psychotherapy between Indigenous peoples and non-Indigenous peoples. As part of my internship with Medipsy, I've had the privilege to work with this community. I'm going to try and paint a unique cultural consideration that shapes therapeutic practices for these distinct peoples. So the first really involves understanding Indigenous perspectives. We can fairly safely assume, Indigenous peoples have a different cultural worldview, right? Indigenous cultures, they emphasize interconnectedness with nature, with community, and with spirituality. And also, sadly, what's involved in this perspective is historical trauma. There's centuries of colonization, of forced assimilation, of systemic oppression that have left lasting scars and actually still continue to injure Indigenous communities. There's also healing traditions that come into play. Indigenous healing practices often blend spiritual rituals, wonderful storytelling, and participative and inclusive communal support. So obviously, though, we're going to have unique challenges in providing psychotherapy to Indigenous peoples. Not in the least, as far as most important is the colonial legacy. Western psychotherapy can be perceived as a continuation of colonial control and continued erasure of Indigenous knowledge. Right? There's also a cultural mismatch between, the Eurocentric therapeutic approaches, right, which may overlook or even clash with Indigenous values, beliefs, and healing practices. There could be trust issues that come into play to challenge, delivering psychotherapy. Historical trauma and mistrust of outsiders can create barriers to engaging in therapy, but even more so, even perhaps more importantly, to seeking therapy from non-Indigenous peoples. And if we look at Indigenous healing paradigms, there's a lot of special, unique features there. There's the holistic approach, right? In Indigenous healing, there's a large importance. It's paramount that it encompasses physical, emotional, mental, and spiritual dimensions. Fortunately for us, Western psychotherapy and psychiatry is catching up to that and in making sure that we can deliver a holistic model as well. So we are catching up. There's also cultural relevance that kind of factors into the Indigenous paradigm. There's also a more active element of community involvement where healing occurs. Really, it's situated within the context of the community, which this is emphasizing collective well-being, as opposed to non-Indigenous psychotherapy practices, which have a strong individual focus. Western psychotherapy often emphasizes individual autonomy and self-expression. In non-Indigenous psychotherapy, there's this large element of professionalization, where therapy is typically delivered by a licensed mental health professional in a clinical setting. Right. So what else is essential when noting these differences? Well, one, there's a need for cultural competent psychotherapy. So what does that entail? Well, it entails cultural humility. Therapists must acknowledge their limited understanding of Indigenous cultures and really commit to ongoing learning, right? It's a lifelong learning. You need to foster this collaborative approach where therapy is co-created with clients and it's integrating Indigenous healing practices with Western techniques. And there has to be an element of community integration as well, where therapeutic interventions extend beyond individual sessions to involve families, elders, and other community leaders. When I'm thinking of the academic learnings and elements that come in that have been agreed upon, like keeping Joseph going in mind, Indigenous practices must address healing intergenerational trauma, right? And Indigenous healing does. It addresses intergenerational trauma through communal rituals and storytelling. There's an element of cultural resilience as well, where Indigenous peoples draw strength from their cultural heritage and their spirituality in the face of adversity. And there's a therapeutic integration that's really important, right? Effective therapy for Indigenous clients does blend Western techniques with Indigenous healing traditions. Therapists need training to recognize and address cultural biases and power differentials in therapy that happen in the rooms. So that leads us now kind of, I guess, intuitively into what are the best practices that we could come up for providing psychotherapy for Indigenous peoples. First is having culturally adapted interventions. So having therapies tailored to Indigenous cultures, that can promote engagement and effectiveness. We need to actually also factor in community partnerships. Collaborating with Indigenous communities ensures culturally responsive and sustainable mental health services. Unfortunately, here at Medipsy, we've had lots of interactions and collaborations with local groups, organizations, the Friendship Center of Montreal, Cattery Hospital. So it's really been an enriching and eye-opening experience. And we also have now, come on board and adopted the best practice of advocacy and empowerment, supporting Indigenous self-determination and advocating for systemic change are integral to healing. So to wrap it up, providing psychotherapy to Indigenous peoples it requires a deep understanding of their cultural context, their historical experiences, and their healing traditions. By embracing cultural humility, integrating Indigenous perspectives, and fostering collaborative partnerships, therapists can continue to create inclusive and effective therapeutic services for our clients. And if you've ever had the honor of working with Indigenous peoples, then you will have surely remarked at how they are much more than their trauma. They also carry intergenerational resilience, courage, knowledge, penchant for joy and humor, which deserves equal attention in our conversations and therapeutic spaces. So let us continue to strive for culturally competent and equitable mental health care for all. Thank you for your ear.